It's interesting. I thought one of the things that you said was that if we do get a Fed-induced recession, that doesn't have to be painful or long.
Yeah, if you look at history, okay, and there's no common one type of recession, but a fairly common one is Fed raising the rate to slow down the economy, overheated economy to kind of keep inflation in check. And if I remember correctly, if you look at the six of them, some of them were just short. They were 6 months, 9 months long. You didn't even go into negative growth really for much more than a quarter or so. And so, and unemployment goes up, but not a lot. So hopefully that's the case. I do think you have underlying all of that a very strong consumer, very strong businesses, and we're hopefully maybe Omicron. We don't know what the future variants will be, but hopefully Omicron may be putting this COVID-19 in the rearview mirror. And if that's true, we may have a very, very good spring.
Obviously, healthcare has been one of the areas that's been causing inflation for a long time. But given that inflation is so hot, it seems relative now. Switching to healthcare, I want to talk about your new venture. You launched Morgan Health last year. You tapped Dan Levinson, the founder and CEO of Avalier Health, to lead it. And one of the big parts of that is that you've got $250 million you're going to put to work in venture investments. Why is that so important?
So look at the big picture here. So America's got some of the best healthcare in the world. Pharma, doctors, medicine, hospitals. I'm a beneficiary of that. But it's 18% of GDP. The rest of the world, or developed world, is at 9%. And we don't have the best outcomes. Our maternity care, our obesity, our cancer care, blood pressure is worse than a lot of other folks. So we can acknowledge those problems and attack them. So we're attacking from the employer standpoint. We've got fabulous people who manage our healthcare, but Dan Mendelsohn has hired a great group of people and who are going to be using things like AI and cloud, accountable care. So we're trying this thing in Columbus through Vera, where we're going to try to get people more primary care physicians to help them navigate, through the healthcare system. If you could just do a better job managing people's blood pressure or managing musculoskeletal diseases, you can have better outcomes at a lower cost. If you can intervene properly, if you get more people to do wellness programs. And I think AI and cloud will do a lot here. So, we hope for better outcomes for our folks through better healthcare and more affordability. And as part of that effort, the team is also looking at the racial healthcare. It is true that people who are lower income, have worse healthcare than people higher income, and we should do something about that. I should point out to the people on CNBC, JPMorgan for years has subsidized healthcare much more for lower paid individuals than for higher paid. Part of it in recognition of that.
I had talked to Dan about some of the efforts that they're doing, and they've gotten going very quickly. You've got one contract in Columbus, Ohio. You have 38,000 employees that is going to be based on trying to manage chronic conditions. And then you're working on a deal with Kaiser Permanente out in California to deal with these health equity issues and try to bring down those health disparities. But you're also spending $1.8 billion a year on healthcare. Certainly, you are intent on bringing those costs down. How do you measure success here? Is it about outcomes or is it about bringing costs down?
It's really about outcomes, outcome. And then you make a very important point. We spend like $35 billion a year on salaries, $2 billion a year in healthcare. But that $2 billion may be the most important. That's 250 million people. If they take care of themselves, they have better lives, they're more productive, they're happier, they're taking care of their kids. So that is so important we get that right. And it's all about better outcomes. Better outcomes is that we know that we find out you have high diabetes, we do something about it. We find you have high blood pressure, we do something about it. If you want to get you to navigate you through the healthcare system with more and more transparency, more affordability, but part of it will be affordability, both for the economy, the companies, and the individuals. Because the thing they complain a lot about is the cost of healthcare. Like this whole thing about surprise billing. Hospitals should stop surprise billing. There is one I know about who said, we will not allow physician practice in here that are out of network. And so there are a million things we can do for transparency and getting consumers healthier, happier, and probably even at a lower cost.